You've had a thought about your doctor, and you're too scared to say it aloud. It sounds something like this. Is amputation really my only option, or is he just taking the easy route? You pushed that thought away the second it came up because questioning the person holding your chart feels like the most dangerous thing you could do right now. I've been practicing podiatric limb salvage for a long time, and I can tell you with certainty the questions patients ask me in private are completely different from the questions they ask in their appointment. In private, they are sharp, specific, and exactly right. In the appointment, they nod and they say, okay. They walk out with answers they needed because the question feels too dangerous to ask. In this video, I'm going to answer 5 of those questions directly, the ones I hear most, the ones patients feel they can't ask. By the time we're done, you'll have the information you were owed before anyone handed you a consent form. Patients are conditioned to believe that when a doctor recommends amputation, it's because the medical evidence leaves no other choice. That recommendation feels final and objective, like a result of the calculation that only the physician is qualified to run. The reality is that amputation is, in many cases, the path of least resistance for a provider who doesn't have the training or motivation to find another way. It resolves the immediate problem quickly. It removes the complexity. And in a medical system that's stretched thin and moves fast, that matters more than most patients realize. The majority of amputations performed on diabetic patients in this country should not occur. That's not a fringe opinion. That's a pattern I see in my practice, and it's consistent with outcome data that follows diabetic amputation in patients over time. Your question isn't disrespectful. It's not paranoid. It's medically appropriate. You're allowed to ask your physician what alternatives were considered and why were they ruled out. A thoughtful answer to that question isn't optional. It's the baseline of informed consent. If the answer you get is vague, or if the question is met with frustration, you've received incomplete care. That's the honest answer to the question that you are afraid to ask. Most patients go into amputation consults thinking about their leg. They're thinking about mobility, about prosthetics, and what life looks like after. Very few patients are told what happens to the rest of their body because the conversation rarely gets that far. Amputation doesn't just remove a limb. For a diabetic patient, it initiates system cascade. Cardiovascular system isn't built to absorb. The heart is designed to pump blood to the tip of the toe. That architecture exists for a reason. When you remove the destination, you don't reduce the demand on the heart. You disrupt the entire circuit. Diabetic patients who undergo below-knee amputation carry an 80% mortality rate within 5 years. Not because of the surgery itself, because of what follows. The cardiovascular strain, the metabolic load, the system's inflammatory burden of living with an altered circulation system in a body that was already compromised. The number is rarely in the preoperative conversation. It should be the first thing discussed. Before agreeing to an amputation, you have the right to ask, what are the 5-year outcomes for diabetic patients who have this procedure? If your provider doesn't have an answer or deflects the surgical success rate without discussing downstream mortality, you're missing a critical piece of the picture. The surgery itself may go well. The question is, what comes after? And over what timeline? You deserve that full answer before you decide. If this is giving you language you didn't have before, subscribe. Every video in this series is built around questions patients most need answered and rarely get. Hit subscribe so you don't miss the next one still to come. Patients often believe that refusing or delaying an amputation recommendation is medically dangerous, and that every day of hesitation is a day that the infection or wound is spreading, and that the doctor's urgency is a signal that there's a genuine no time to think. There's a meaningful difference between limb-threatening emergency that requires intervention within hours and a recommendation that has been building across multiple appointments. Most patients don't have the language to tell those two situations apart. And in the absence of that clarity, urgency becomes a default to foreclose the conversation before it starts. Amputation is permanent. There are no procedures after that one to restore what was removed. That permanence earns you the right to do due diligence. You're allowed to say, before I sign anything, I want 48 hours to get a second opinion from a limb salvage specialist. You're allowed to ask, is this an emergency requiring intervention today? Or is this a recommendation that we can evaluate over the next few days? A physician who's unwilling to answer those questions clearly or responds to them with pressure instead of information is not giving you complete care. Buying time for a second opinion isn't denial, it's the appropriate response to a permanent decision. By the time patients reach me, many of them have already been told by multiple providers that nothing more can be done. And there's a part of them that thinks the question I just asked is naive. There's no hope at this stage is something they no longer have permission to hold. That they've been embarrassing themselves by believing the situation could still turn around. The belief that no one can help is almost always based on the limits of the provider the patient's already seen, not the actual limit of what's medically possible. Those are very different things. A patient named Bill came to see me after 7 different physicians had told him there was no option except amputation. He had a heel bone infection that the conventional approach couldn't resolve. I used 2 techniques that aren't in the standard toolbox, and that leg is still attached today. Bill isn't a miracle. He's an example of what happens when a patient refuses to accept the conclusion of providers who weren't trained to find another way. Call me. I mean that directly. Regardless of the state you're in, regardless of the company, reach out and describe this situation. I'll give you an honest opinion about whether the amputation is truly necessary. In the majority of the cases I review, there's a path that was never offered. That path may require a specialist with different training backgrounds. It may require traveling to a different facility. But the answer to, is there someone who could help save this, is more often than not yes. Patients who find out that alternatives existed often assume they've missed something, and the information was available, they just didn't know where to look. That the system, however imperfect, was at least trying to surface everything relevant. The medical system rewards fast answers, not complete ones. A physician's training, their specialty, and the economic incentives around them determines what they can offer. If you see a provider who hasn't been trained in limb salvage, they can't offer you limb salvage. It's not that they're hiding it, it's that the tool doesn't exist in their kit. The patient who asks the most questions and pursues the right specialist gets the best outcome. That's always been true. And it'll keep being true regardless of how the system changes around it. You're the one constant in your own care. The providers rotate, the recommendations vary, but you're in every appointment, and you're the one with the full picture of what's been recommended, what was refused, what was tried, and what was never mentioned. Use that. Ask the questions you were afraid to ask. Push for the answers you were told not to expect. The patients that do that consistently get outcomes that surprise even their doctors. None of these questions are disrespectful. None of them make you a difficult patient. They make you an informed one. And informed patients in this specific situation save their own limbs. You have every right to the information in this video before you make any decision. If you have a family member who's been told amputation is the only option, share this with them today. And for specific steps of what to actually do in that appointment, the next video covers exactly that. Watch that one. See you then.